shocking data presented to Parliament has revealed that nearly 450,000 prescriptions for antidepressant drugs were issued to children last year alone.
Meanwhile, psychotherapists are saying that young people are displaying withdrawal symptoms from social media, similar to that of drug addicts. So what have we done to our kids and how can we fix it? Well, joining us to discuss this in more detail are Marjorie Wallace from the mental health charity Sane.
And we're also joined by Giles from the rehab organisation Castle Health. Marjorie, let's start with you if we may. Thank you very much indeed for joining us this morning. I'm very worried about children's mental health. How worried are you?
Well, at Sane, we've been worried for the last 5 to 10 years because there seems to be an escalating number of children and young people who are self-harming, seriously self-harming, not just crying for attention, but being seriously self-harming. They're also having suicidal thoughts, and they are getting more and more eating disorders. I mean, in the last few years, the numbers that have been diagnosed with this have risen by about sort of 30 to 40% higher in the last 2 years. It's really alarming. We've created a generation of lost, lonely, disconnected people, and we don't have the services to help them, and we haven't done the research into mental illness amongst that age group.
And Jamie, just to bring you in, you're director of outpatients at Castle Health. You've treated young people for this kind of an addiction. But social media is such an umbrella term, isn't it? There can be some forms of social media, I expect, that are actually good for somebody's mental health. But as we've been discussing on the show this morning, so often social media can be quite toxic. Is it more about what kind of social media these children are addicted to, or is it just that umbrella term?
Yeah, I think that's a really interesting point, and thank you for raising it, because I think there is that instinct to say, oh, social media bad, and we should bring down sort of draconian regulations on all aspects of it. I think social media can be an incredibly powerful force for good, as we've seen in so many areas of the world. You know, I'm thinking of the Arab Spring, for example. However, we're working with children who are not as responsible or even biologically developed, physiologically developed as adults. They're not capable of making the same decisions or interpreting fact from fiction in the same way that adults are. So we need to really try and work with social media providers to ensure that those environments are safe for children. I remember myself at the age of 12, when I first had my first online experience, it was presented to us as a kind of walled garden. And I think we've gone quite a long way since then.
And Marjorie, just to bring you back in here, are we surprised that children's mental health has suffered when we locked them up in COVID? We made them put masks over their faces so they couldn't communicate. They were isolated. They were away from their friends. They were depressed. Are we surprised?
I'm not terribly surprised, but actually that wasn't really anybody's fault as such, as you know. But what we did create, we seem to have created a very safe and unthreatening world. I know quite a lot of people, but not just family, but friends and children. And it's particularly the age group that's particularly at risk are the sort of girls, young girls, 13 to 15, 18 years old. And what they say to me is that they don't feel safe unless they have their smartphones on them. They literally feel too afraid to go out of their bedrooms in the morning, or to walk down the street, or to take a bus, or to go to school, unless they have their smartphones on them. And this reliance and dependence on the smartphone and on the 24/7, hundreds of messages a day from people they don't really know, but who are competitive with them when it comes to things like self-harming and suicidal attempts. Quite a lot of them are going onto the dark web. They're often ordering things like sort of eyebrow pencils or something that have a sharp blade so that they can cut themselves. It's really quite a frightening world that they're in, and the parents are even more desperate, because when they go for help to the GP, it takes a long time to see a psychiatrist. They go help from the GP, and what is a GP going to do? He's going to offer talking therapies, which is the first line of treatment, but there's a long wait list, a logjam, and it's up to 18 months that many people have to wait for this. And you can imagine that with a highly distressed teenager or a child who's highly distressed, up to 18 months. Or they can offer antidepressants, and as we've seen, there's a huge number of antidepressants. Under 25, I think it's nearly 5 million a year. Or they send them away with nothing, and that's almost the worst. And those are the people who call us because they said, we've got no help, nowhere to turn. And to reach the threshold to be referred for the help that they have to wait a long time for, they have to be pretty on the edge. They're not just troubled young teenagers.
Well, Jamie,
they are really ill.
Yes, absolutely. Well, just bringing Jamie in again, according to experts, young people are displaying physical withdrawal symptoms from social media, similar to those of drug abusers. We've only got about a minute left. Can you explain what those withdrawal symptoms would be?
Yeah, absolutely. Just to give you an outline sketch of how this works. So the comparison that my esteemed colleague Tony Marini made was that of cocaine withdrawal. Now, cocaine and social media work on the brain in the same way, in the way that dopamine is blocked by those either behavioral or physiological inputs. So what you're seeing is people who are presenting as restless, irritable, discontent, presenting symptoms of anxiety, depression, a feeling of listlessness, a feeling that, emptiness, and that almost life is not worth living. So it's extremely concerning. And I would also say that at Castle Health, we've been dealing with substance-based disorders, substance misuse disorders for many years now, alcohol, cocaine, heroin, and things like this. And
Jamie,
beginning
sorry,
to see social media.
Sorry, Jamie, to cut you off there. We are running out of time, but thank you so much for all the work that you do. And thank you both for joining us this morning. Thanks, Marjorie Wallace from Sane and Jamie Giles from Castle Health there.